So the topic today is impulse control disorders. So what are impulse control disorders? These disorders are behaviors that individuals repeatedly engage in, and these behaviors are potentially harmful. However, think about these disorders as an impulse. It's an urge that an individual has to pursue some kind of behavior, and people who suffer from these disorders say that, it comes on as this kind of overwhelming urge and I can't fight it. I'm not able to stop myself. And they experience this extreme sense of kind of anxiety or desperation if they're not able to engage in the impulsive behavior. So specific impulse control disorders. So kleptomania. With kleptomania, these individuals experience this intense urge to steal things, to steal property that is not theirs. Now, the interesting thing about kleptomania is that, individuals will take things that have very little monetary value, might have no monetary value at all, or, they might be engaging in shoplifting in a store, even if they actually have the money to pay for something like this. You might recall Hollywood celebrities like Winona Ryder. She got cited multiple times for shoplifting, and she likely suffers from kleptomania. Clearly, she has the money to purchase whatever she would like, but it's this overwhelming urge to take things. So sometimes individuals with kleptomania will take really odd things. Like if you're staying in a hotel room, for example, you might steal the remote control or the hotel wall art. Clearly stuff that you don't really need. Okay, pathological gambling, another impulse control disorder. Obviously, this is the urge to gamble persistently. So with pathological gambling, this isn't someone who gambles every now and again. This is Okay, so individuals who have pyromania then suffer from the impulse control disorder related to this intense and extreme urge to start fires. So with pyromania, there are a few things that you should note here. These individuals are fascinated by fires. So sometimes they will pursue careers that revolve around fires. So they might, try to become a firefighter, volunteering for things of that nature. And most of the time, these individuals are male as well, so that's something else that you should note here too. Okay, with trichotillomania, the compulsion here, or the impulse that the individual feels, is this intense urge to rip out your own hair. And so this can be hair that's on your head, it can be your eyebrows, it can be, hair that's on your arms, hair anywhere on your body. And so with trichotillomania then, the individual has this urge and they calm the urge, or they calm the anxiety by pulling out a piece of their own hair. So you can imagine then how this could result in some pretty specific problems. So for example, a lot of times individuals who have this will pull out their hair and then they might eat it or like chew on it, suck on it, and so they actually ingest their hair, resulting in this hairball in their GI tract, which can result in severe abdominal cramping and pain. Moreover, can result in things like nausea and vomiting. Another thing to note with trichotillomania, or trick as individuals who have this call it, it can also result in some, embarrassing physical problems too. In one of the videos that's associated with this chapter, check out the portrayal of this woman who has essentially ripped out hair from many different sections on her head, and so she's bald in several areas, and she has to wear a wig to cover that problem. Okay, so our final impulse control disorder, intermittent explosive disorder, or IED. So individuals who have intermittent explosive disorder have these urges to basically fly off the handle, essentially, to respond to some kind of situation with very, very intensive anger, and oftentimes violent behaviors go along with this as well. So these individuals will feel this kind of buildup, as with our other impulse control disorders, and then the release comes through this expression of these rage, violent behaviors. Oftentimes, individuals who have IED have a history of other associated mental health problems as well. So this can be comorbid with things like bipolar disorder, certain personality disorders like borderline personality disorder, which, as you may recall, involves that extreme shifts in emotion. Bipolar disorder involves that as well. And then antisocial personality disorder too, which involves that disregard for other people, this tendency towards violent behavior, a lack of remorse. The one difference here, though, with intermittent explosive disorder compared to, say, violent behaviors that occur exclusively within the context of antisocial personality disorder, is that these individuals who have IED do feel guilt, and they do feel remorseful after they have gone through one of these rages. So they do feel bad about it. However, when they're in the rage, they describe themselves as feeling like they're completely out of control. They have no control over their behavior, which can, potentially be quite dangerous. I'll encourage you to read the case study in your textbook about a teacher and his experience with intermittent explosive disorder, which from the case study, it sounds like this man probably lost his job due to flying into one of these rages at work and attacking another coworker.